our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB.
House Health and Human Services will now come to order. Madam Secretary, can you please call the roll?
Representatives Rehfeld.
Here.
Fosness.
Here.
Halverson. Here. Jordan.
Here.
Garcia. Here. Emery.
Here.
Andera excused. Kaiser. Here. Schaefbauer excused. Manhart.
Here.
Baxter. Here. Heineman.
Here.
Mulder.
Here.
We have a quorum, Mr.
Thank you, Madam Secretary. We have a quorum. The chair will entertain a motion to approve the minutes of our last meeting. Moved by Representative Heineman, seconded by Representative Kaiser. All those in favor will say aye. 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 All those opposed say nay. Our minutes are approved. Just a few reminders before we begin. Please go ahead and silence your electronic devices. If you wish to testify, please make sure you're signed in via the iPad, electronically online, or on your phone at the QR code or at our committee site. Please remember that all questions and comments will flow through the chair. If you have handouts for the committee, please distribute them to our pages and they will hand them out to us today. Speaking of pages, we'll have them come on up and introduce themselves. Of course, we want to know who you are, where you're from, school you go to, and then your future plans and your favorite Disney movie. Come on up. They paused when they heard Disney movie.
My name is Veronica Thomas. I'm from Harrisburg and Harrisburg High School. After high school, I want to go to a four-year institution and become a paralegal. And my favorite Disney movie is Tangled.
My name's Isla Rohde. I'm from Sturgis. I'm homeschooled. My future plans are to be a pilot. And probably Toy Story or something like that. So.
Perfect. Thank you for being here today, and thank you for helping out this week and next week. So with that, we'll take our bills in order as they appear on our agenda. So first up on our agenda is Senate Bill 14, modify provisions related to the practice of pharmacy. We'll take proponent testimony.
Morning, Mr. Chair, committee representatives. My name is Tyler Latch, and I'm the executive director from the South Dakota Board of Pharmacy. The mission of the South Dakota Board of Pharmacy is to protect and promote the health and safety of the public by supporting pharmacists and pursuing the highest quality pharmaceutical care through education, communication, licensing, regulation, and enforcement. I am here today in support of Senate Bill 14, which is being brought forward to accomplish two important objectives. First, the bill clearly defines the role of a pharmacist in charge and distinguishes between ownership changes and pharmacist in charge changes within a pharmacy. Second, the bill allows patients a safe and convenient option to pick up their prescriptions at a location that is not a licensed pharmacy. Regarding the pharmacist in charge provisions, Section 1 defines a pharmacist in charge. Sections 3, 4, and 5 address pharmacy application processes. Sections 6 and 7 outline the requirements for a change in the pharmacist in charge when there is no change in ownership. And lastly, Section 9 provides the board with the authority to take action on a pharmacy and a license when necessary. These updates were needed to clarify and differentiate the difference between an ownership change and a pharmacist in charge change. With respect to the drop site provision, Section 10 establishes the framework for a remote drop site. Section 2 requires the board to promulgate rules governing these sites. Section 8 states that the remote drop site locations do not constitute unlicensed dispensing. With our mission in mind, Senate Bill 14 was drafted to provide the public with a safe and convenient way to receive medications without creating a new license type or a new fee, while still maintaining regulatory oversight and strong patient safety standards. Through rulemaking, the board will allow a licensed pharmacy to establish secure locations where patients can pick up prescriptions without having to go to the pharmacy or rely solely on mail delivery. The Board of Pharmacy worked closely with LRC to develop the version of the bill that is before you today. In closing, Senate Bill 14 clarifies pharmacy licensure process, including changes in pharmacist in charge and ownership, and allows pharmacies to establish safe and secure remote drop sites when needed. I respectfully ask for your support for a yes vote on Senate Bill 14. Thank you for your time and consideration. I appreciate the opportunity to provide input on this legislation and will stand by for questions.
Thank you, Mr. Latch. Further proponent testimony for House, or Senate Bill, sorry, first day, Senate Bill 14.
Good morning, Mr. Chair, members of the committee. My name is Craig Mattson, and I'm a registered lobbyist for the South Dakota Pharmacists Association. Easy for me to say this morning. We rise in support of this bill, and generally we are supportive of the Board of Pharmacy. We think this is a good piece of legislation, and we hope that you can support it. Thank you.
Thank you. Further proponent testimony for Senate Bill 14.
Good morning, Mr. Chairman, members of the committee. Nathan Sanderson. I'm the Executive Director of the South Dakota Retailers Association. We have a number of pharmacies as part of our organization and several pharmacists on our board of directors. This has been a good process throughout. It went very smoothly through the Senate side. We don't foresee any problems, and we would encourage your strong support. Thank you.
Thank you. Further proponent testimony for Senate Bill 14.
Good morning, Mr. Chair, members of the committee. My name is Jacob Parsons. I'm a registered lobbyist on behalf of the South Dakota Association of Healthcare Organizations. We'd align ourselves with the previous proponents and just say that this is a way to ensure access to care in our rural communities for our patients. We ask for your yes vote. Thank you.
Thank you. Further proponent testimony for Senate Bill 14. Seeing none in the room, I will just make note that we were informed that we do have somebody online standing by just for questions if needed as a proponent. So just to note that before we move to opponent testimony. Opponent testimony for Senate Bill 14. Opponent testimony, going once, going twice. Seeing no opponent testimony for Senate Bill 14, we will waive the need for rebuttal. Oh boy. Struggling. And move right into committee questions. Are there committee questions? Seeing no committee questions, we'll move into action and or discussion. Is there action and or discussion on Senate Bill 14? Representative Heineman.
No, Mr. Chair, I move do pass on Senate Bill 14.
We have a do pass motion made by Representative Heineman and a second by Representative Kaiser. Any comments on that motion, Representative Heineman?
Thank you, Mr. Chair. Last year, as you know, we worked through the split between the Pharmacy Board and the Association of Pharmacists. I think that was a pretty smooth transition, even though at the time there was a lot of angst. So I appreciate you working through that. Now this is an appropriate continuation of that structure, trying to figure out where everybody's going to be. So I support this motion.
Okay, any other comments on the motion of a do pass motion for Senate Bill 14? Seeing none, what we have before us, as mentioned, is a do pass motion for Senate Bill 14, moved by Representative Heineman, second by Representative Kaiser. All those in favor will say aye. Those opposed will say nay. Madam Secretary, please call the roll.
Representative Rayfeld.
Aye.
Fosnes.
Aye.
Halverson.
Aye.
Jordan.
Aye.
Garcia. Emery.
Aye.
Andera excused. Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter.
Aye.
Heineman.
Aye.
Mulder.
Aye.
12 ayes, 1 excused.
Having received a majority vote of the committee, Senate Bill 14 will move to the floor with a do pass recommendation. And I would certify that for consent. All right, thank you. Okay, up next, Senate Bill 89. Create a task force to study the provision of emergency medical services as an essential service and the funding thereof. We'll open up with proponent testimony. Representative Emery.
Thank you, Mr. Chair. I'm here excuse me. I'm here today to speak in favor of Senate Bill 84, an act to create a task force to study the provisions of emergency medical services as an essential service, and just as importantly, how the service is funded. I come to you today not only as a legislator, but as someone who has spent years inside the EMS system here in South Dakota. I've been on the side of the call when
Representative.
Sorry.
You never said your name, sorry.
Oh, I'm sorry. Representative Eric Emery, District 26A. Actually, before I do actually get into my testimony, I do have an amendment that needs to be brought. If I can still bring that. If I can have somebody from the committee bring that.
Okay, well, hang on, we have several listed here, so, oh, okay, no, we adopted two, okay. So this would be 89D?
89 Delta. Yes.
89 Delta.
So moved.
All right, well, I think I had a motion over here first, so if you want a second, perfect. So we have, this is a voice vote, but just as a reminder, we have a motion to move Amendment 89D by Representative Baxter, seconded by Representative Fosness. All those in favor will enthusiastically say aye. Aye. Those opposed, nay. The amendment is adopted. We have now Senate Bill 89 as amended. Go ahead.
All right, thank you, Mr. Chair. So the question isn't whether it should be respond or how. It isn't about how we respond, but it's how we staff those ambulances, whether a unit is available and whether the ambulance can be kept in service after the call is over. In South Dakota, EMS already functions as an essential service in practice. When someone dials 911, an ambulance responds in any of the 66 counties, regardless of the ability to pay, distance to the hospital, or time of day. The expectation exists statewide, and the funding structure to support that level of readiness does not. This bill did not appear out of thin air. Senate Bill 89 is a direct correlation of the work that this legislature began in 2025, starting with House Bill 1043, which is sought to recognize EMS as an essential service formally. While Senate Bill 1043 did not ultimately pass, it sparked an important and necessary conversation, one that continued through the 2025 EMS Interim Committee Summer Study. The summer study identified that EMS funding problems. Senate Bill 89 is the next step that charges the focused task group with designing a sustainable funding solution. The interim committee heard consistent statewide testimony from EMS professionals, counties, municipalities, hospitals, and rural leaders. The message was clear. EMS already functions as an essential service, but we are asking local governments and volunteers to carry that responsibility without a stable statewide funding framework. Across South Dakota, EMS systems are under severe strain with workforce shortages, aging equipment, rising costs, and reimbursement structures that do not reflect the true cost of readiness. In many communities, a single failed hire or a single ambulance out of service can jeopardize the coverage for an entire region. From a system perspective, EMS capacity erodes, the effects cascade. Emergency departments experience increased boarding and delayed transfers. Law enforcement and fire departments are pulled into medical response roles that they are not designed to fill. Rural hospitals face increased liability and longer patient stabilization times. These are measurable system impacts, not hypothetical concerns. Senate Bill 89 is intentionally narrow, responsible, and deliberate. It does not mandate a one-size-fit-all solution and does not impose any new funding mechanisms, or it does not impose new funding mechanisms today. It instead established a bipartisan task force that examines the sustainable funding for EMS as an essential service, engages stakeholders who are directly responsible for delivering the EMS funding, and evaluates whether existing investments, including the Rural Transformation Program, can be aligned to support the emergency response, and to return a data-driven responses by November 1st, 2026. The structure of the task force reflects the reality that EMS funding touches healthcare, taxation, and local government. The cross-committee representation is a strength of this bill, not a weakness. Ultimately, Senate Bill 89 acknowledges a simple truth. South Dakota is already relying on EMS as an essential infrastructure, and it's the legislature's responsibility to ensure that infrastructure is sustainable. This bill gives us the tools to finish the work that we started and to do it the right way. I respectfully ask for your support of Senate Bill 89, and I will stand by for questions.
Thank you. Further proponent testimony for Senate Bill 89. Good morning.
Good morning, Mr. Chair, committee members. Tim Reed, District 7. Just thought I'd first explain just a little bit about the Amendment 89D that was put together yesterday. If you look at in Section 1.1 and 2, 1 talks about the mechanisms to fund counties, municipalities for the provision of emergency medical service as an essential service. We added 2 in there because there's another part of this funding that we also need to discuss, and that has to do, and sometimes the term is used when the ambulance rolls, and that's the payment for that time that the ambulance went out. And so that's what that section is about. There's also a bill in the House that's discussed, in the Senate, that may be coming over to you in the House that talks about out-of-network emergency services payment. So that's why that's in there. Chair and members of the committee, this bill is a direct response to the work of the Emergency Medical Services Interim Committee, which I co-chaired during the 2025 interim. I want to thank the representatives who served on that committee for their engagement and thoughtful contributions, and that would be Representative Garcia and, of course, Representative Emery. The committee examined the availability of long-term sustainability of EMS across South Dakota with a focus on workforce, rural service gaps, and funding challenges. What we learned is concerning. Call volumes continue to rise, reaching 116,740 requests for ground ambulance services in 2024. While the system capacity is under strain, more than 86% of counties contain areas considered ambulance deserts, where transport times exceed 20 minutes. Workforce shortages remain the single greatest challenge, and the average of EMS personnel is now 51. It is important to say clearly that this is not a decline in civil commitment. South Dakota remains a high volunteer state. The challenge is capacity. Volunteer EMS now requires professional level training, availability, and responsibility, while many families face tighter schedules and greater economic pressures. Fewer people are able to sustain that level of commitment over time. At the same time, EMS remains one of the only core public safety services not designated as essential. The interim committee did not recommend immediate designation, but it did expressly support continued dialogue on 2 issues: how EMS should be funded and whether essential service designation is feasible and sustainable. So that's what Senate Bill 89 is all about. It's that work, and we need to do the work to get there very carefully and responsibly. This bill does not impose a mandate or assign costs. It establishes an EMS service funding task force to examine funding mechanisms that recognize and support counties and municipalities in providing EMS as an essential service. It engages stakeholders and return recommendations to the legislature. Before making long-term decisions about designation or funding, we owe local governments clarity about what sustainable service-aligned support looks like. This bill creates that structured, transparent process. When someone in South Dakota dials 911, access to emergency medical care should not depend on geography or chance. Senate Bill 89 ensures the next decisions we make are informed, fiscally responsible, and fair to the communities providing the service. For those reasons, I respectfully ask for your support.
Thank you. Further proponent testimony for Senate Bill 89. Good morning.
Good morning, Melissa Makestead, Secretary of Health. Just want to thank the good representative and senator for bringing this bill forward. Some of you sat on the summer study, and in 3 meetings, I bet you figured out that how complex the EMS services are. Just for a little bit of level setting, 90% of our ambulance services are volunteer. And so, and just as Senator said, these are good, dedicated people, but 90% volunteerism, you wouldn't expect a hospital to run on 90% volunteers. You would hope that people have more reason to come to work besides just civil duty, which I absolutely appreciate in these folks. One thing I want to point out, these are not, the ambulance service is not owned by the state. It is regulated by the state. We regulate ambulances to make sure that they are inspected and meet all the standards. Paramedics and EMTs are regulated by the Board of Medicine, but these are not owned and operated by the state. They're owned by counties, municipalities, tribes, IHS, hospitals, private businesses. So add to the level of complexity. And then add a reimbursement model that is some county, some city, some grant funding, some reimbursement, and the model gets even more and more complex. So I appreciate that this conversation's not ending at the end of the summer study, which a lot of times things do. Summer studies come and go and don't really necessarily always accomplish things. But this particular summer study had a couple good bills that have came through here that I think were very impactful. And I appreciate the senator wanting to have this conversation that continues, because we're not done talking about this. And we certainly haven't solved the long-term challenge of what is reimbursement and sustainability. And then I also think this is a really good timing. The Rural Health Transformation Funds has a large amount of dollars that are specific for EMS infrastructure and sustainability building. So I think it's really important for the legislators to stay engaged in this and having this on front of mind as we journey through these for the next 5 years with those funding too. So we stand by and support, and stay by for questions as well. Thank you.
Thank you, Madam Secretary. Further proponent testimony.
Morning, Mr. Chairman, members of the committee. Maynard Konechny from Kimball, representing the South Dakota EMS Association. We rise in support of Senate Bill 89. The committee, that summer study, did a fantastic job of going through and coming up with bills to bring to this legislature this year. And this is another one of them. As I said, the discussion is not over. It's still a funding issue and a reimbursement issue that we have. Without these things, with the cost of equipment nowadays, when we first started 50-some years ago, we begged, borrowed, and stole probably to get to where we are today. But with the price of equipment and ambulances and all the equipment, that's not feasible. We need a funding source that is reliable, that we can rely on. The volunteers are there. It is getting harder to get volunteers, but they're still there in the rural communities doing their job. And we highly recommend that you move Senate Bill 89 on and let that task force continue to work and come up with some more great legislation to assist us and move us forward. And I'd stand by for any questions. Thank you.
Thank you. Further proponent testimony for Senate Bill 89.
Mr. Chairman, members of the committee, Dean Krogman, I represent South Dakota State Medical Association, and we rise in support of this legislation. Thank you.
Thank you. Further proponent testimony for Senate Bill 89. Seeing none, we'll move to opponent testimony for Senate Bill 89. Is there any opponent testimony for Senate Bill 89? Seeing none in the room or online, we will waive the need for rebuttal and move to committee questions. Are there committee questions for Senate Bill 89? Yes, Representative Shapar.
For the prime, please. Is this study just for rural ambulances, or will cover all ambulances, EMS services in the state? Can you explain that?
Mr. Chair.
Go ahead.
Representative Eric Emery, District 26A. This will encompass the full EMS programs in the entire state, whether it's urban, rural, frontier, tribal, all of this EMS that encompasses all 66 counties.
Representative Heineman.
Maybe the prime can answer it, or the person that drew up the amendment, I guess. Mr. Chair.
Go ahead.
This might seem quite simplistic, so forgive me if I enter into that space, but especially for the the public to hear. I think a comment that one of the senators made is that if someone calls 911, they shouldn't depend on where they are geographically as to how they get a response. If that's the mentality, why haven't we moved, and again, quite simple, but why haven't we moved to a statewide assessment rather than ambulance districts and tribal districts and whatever? I know that sounds funny, but it's an issue of money. But my question is, why haven't we moved to that?
Mr. Chair.
Go ahead.
Again, Representative Eric Emery, District 26A. So I'll do my best to try to answer that, and if Mr. Konechki wants to answer, he can certainly come up after me. But I think the reason why it isn't centralized or localized, regionalized, however you want to put it, is that just the sheer amount of drive time it takes to do some of those. I think to make that feasible, it just comes down to time and mileage. That if we try to centralize it or create these ambulance districts, sometimes that isn't, on paper that sounds great, but on actual practical application of that's not doable. If we can make that drive time shorter, which sometimes that's hard in South Dakota. I mean, that's inevitable that we can't do that. But if there is mechanisms that we can do to make that drive time shorter, I think would be one of the points of the summer study to really, or this task force, I should say, to look at, how do we shorten that response time?
Follow up. And I'm not promoting, maybe I can further clarify. I'm not promoting a centralization or regionalization. That's not what I'm, and I'm not promoting anything. I'm asking dumb questions, I feel. But I'm talking about the funding side of it. Why hasn't there, again, I'll reiterate, the comment was made when someone calls 911, people expect them to be answered no matter where they're at. So shouldn't that be a responsibility on all the citizens of the state in some way?
Mr. Chair?
Go ahead.
Melissa Makestead, Secretary of Health. I think one of the things that you mentioned, a statewide assessment. We actually completed a statewide assessment in 2024. It's on our website. And it was 9 months of talking with ambulance services across the state, talking to 911 dispatch, talking to hospitals. I think one of the things that we learned in that assessment, that we have extreme diversity in our state. What works in tribal nations is different than works in Pierre, which is different than works in Sioux Falls. But out of that assessment, there were 3 sets of goals. There was the easy, there was the mid, and there was the complex. I will tell you that when we did that assessment, we did not know there were going to be dollars to help tackle it complex. And so luck would have it, we just completed assessment. And so we know the areas that could be impactful. We've done that full assessment already. We've started implementing some of the smaller things, the easier to reach things, the low-hanging fruit. But we did not anticipate having a funding source to help us with the more complex things, to solve for the greater challenges, which has to do with distance and has to do with workforce and has to do with rural and frontier delivery of EMS services. We did not see the funding source that was going to help us overcome those long-term goals. So this is just really good timing of all things coming together at the right time at the right place.
Further questions on Senate Bill 89? Further questions? Seeing none from the committee, we'll close questions and move to action and/or discussion for Senate Bill 89. Representative Garcia.
I move do pass.
Great. We have a do pass motion by Representative Garcia, seconded by Representative Heineman. Comments on that motion, Representative Garcia?
Sure, Mr. Chair. I was on this committee over the summer. There's a great need to further investigate the situations and making sure the monies now that we have for the rural are allocated and we can do a better job. People think 911 is just something that they're entitled to. There should be a triage for, as the Secretary said, there should be a triage for the level of care that needs to be looked at. So I think it's definitely warrants more attention. Thank you.
Thank you. Further comments on Senate Bill 89 and the motion before us? Seeing none, what we have before us is a do pass motion from Representative Garcia, seconded by Representative Heineman. All those in favor will be saying aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representative Rehfeld.
Aye.
Fosnes.
Aye.
Halverson.
Aye.
Jordan.
Aye.
Garcia.
Aye.
Emery.
Aye.
Andera.
Aye.
Kaiser.
Aye.
Schaefbauer. Manhart.
Aye.
Baxter. Heineman.
Aye.
Mulder.
Aye.
13 ayes.
Having received a majority vote of the committee, Senate Bill 89 will move to the floor with a due pass recommendation. Can I certify that for consent? Okay. Nope.
See, there's a few no votes in Senate, so I'd like to just
Okay.
hear if there's opposition, what their thoughts are.
Okay. We'll pull it. All right. With that, we will move to our next bill. Hang on one second. All right, we have Senate Bill 153, prohibits certain restrictions in employment contracts for community service providers. Proponent testimony.
Good morning, Chair, members of the committee. State Representative Logan Manhart, District 1. I bring to you this morning Senate Bill 153. Senate Bill 153 is a small but meaningful change to our employment statutes. We did something similar in 2021 and 2023 with other healthcare items. This bill would clarify that non-compete agreements are not allowed for community service providers. We are clarifying that the free market should decide where someone wants to work and not contract and not based, on a contract that they were forced to sign as a condition of their employment. Community service providers take care of our most vulnerable citizens. Working for them requires a special set of skills that is learned through employment, and preventing competition and preventing people from going to work for other services or other service providers or adjacent in an adjacent profession not only impacts that person, but it impacts adults with disabilities in their care. So I urge a yes vote on this. There are a few other proponents, so I'm going to let them take the mic. Thank you.
Proponent testimony for Senate Bill 153.
Good morning, Mr. Chair, members of the committee. My name is Tara Larson. I'm an attorney here in Pierre and registered lobbyist for Benchmark Human Services. Senator Grove was planning on being here, but she unfortunately had to testify in another committee at the same time, so she may pop in and she may jump in too. But we're here in support of this bill. What is a non-compete? The short answer is it's a condition of employment that prevents an employer from leaving, employee from leaving and working at a similar job within a certain geographical area for a certain period of time. In 2021 and 2023, you as a legislature went through and found various professions in the healthcare industry and said, well, no, we shouldn't apply non-competes to these. These people are highly qualified people. We want to encourage the most qualified people doing our healthcare related matters. And so you said, nope, non-competes should not be permitted for them. What we found kind of missing from that was the community services providers as well, because here's the thing, they are healthcare adjacent. We as the state have a significant interest in making sure that individuals with developmental disabilities are taken care of, are the most qualified people handle those. The Board of Regents, for instance, has entire majors that are dedicated to human services and human support. And what we have seen is not often, but we've seen people running into these non-competes, being either stuck in one position or attempting to leave and having somebody say, nope, you can't do that. And so then we have these people who have trained and are fully dedicated to these people with very vulnerable adults, people with developmental disabilities, prevented from actually doing what their passion is because of these non-competes. This is a free market bill. We see this as a great positive. And frankly, we would urge your support for this. We think it just makes sense with the prior health care provisions that this legislature passed a couple of years ago. This fits nicely in with it, and we would urge your support. I do want to introduce Tacey Dunwoody. She is with Benchmark. She's somewhat of an expert in this kind of issue in this field, and so I would yield to her for really technical questions. With regard to questions about the bill, feel free to ask me, but with regard to technical questions, I would yield to her, and I know there's other people in support, so I will shut up and let them talk. So thank you.
Thank you. Further proponent testimony for Senate Bill 153.
Good morning, Mr. Chair, members of the committee. My name is Tacey Dunwoody, and I'm the Director of Case Management and Family Support Services in South Dakota for Benchmark Human Services. Benchmark supports around approximately 2,300 individuals with developmental disabilities between the Family Support Waiver and the Choices Waiver. We have around 70 staff statewide, and I would encourage you to vote in favor of this bill. And if you have any questions, I will be available for comment. Thank you.
Thank you. Further proponent testimony for Senate Bill 153. Further proponent testimony? You have some online?
Good morning, Mr. Chair.
Well,
this is
hang on.
Ashley
I
Blau.
will call you by name. Hold on one second. We're just getting set up online. All right. We'll start with Terry Bukowski.
Good morning, Mr. Chair and members of the committee. I appreciate the opportunity to come speak in support of Senate Bill 153. I am a mother of 2 adult sons who access services under the Division of Developmental Disability Waivers, and I'm also an advocate in the field for over 25 years. I would appreciate that the support of Senate Bill 153, as it is vitally important for the individuals that in our state that are most vulnerable. Thank you.
Thank you. Ashley DeBlau.
Good morning, Senators, and thank you for letting me testify. I also have a son with a disability in the state, and I support the bill 153.
All right, thank you. And Jessica Anderson?
Hello, thank you for having me today. I have a son on the Family Support 360 waiver, and he receives services. I think it's very important that, the best people in the industry are in the jobs that are right for them. So I do support this bill.
Thank you. All right, with that, we will close proponent testimony and move to opponent testimony. Is there any opponent testimony for Senate Bill 153? Any opponent testimony? Seeing none in the room or online, we will waive the need for rebuttal and move to committee questions. Are there any committee questions on Senate Bill 153? Representative Halverson.
Mr. Chair, this would probably be for Ms. Dunwoody.
Go ahead and state your name, and then he'll ask the question.
Mr. Chair, members of the committee, Tacey Dunwoody.
Thank you for being here and testifying. But my question is this. Is this a big issue? I realize we're probably short on staff in just about every line of work there is right now, but is this a big issue in our state? That are we having a big turnover of people and a problem with the non-compete?
Go ahead.
Members of the chair, Tacey Dunwoody. This has not in the past been a big issue, but just recently it was brought to our attention, and it was a pretty big issue. And this is something that we want to prevent from becoming a bigger issue. So that is why we are in favor of this bill.
Go ahead.
Mr. Chair, where is this issue coming from? Is it coming from employers that don't want to lose people, or is it, I guess I'm not understanding why we should have a problem here.
Go ahead.
Mr. Chair. This is coming from a community support provider that he felt that we were taking his staff, and a young lady who got a degree in human services signed a non-compete clause that she wasn't aware that would be legally binding, and unfortunately she was unable to work for Benchmark Human Services, which she wanted to, and there's a very lack of agencies to work for, especially in the western region of the state, and this lady, I will say, then is no longer able to work for Benchmark Human Services and was very limited in the human services field with where she could work.
Further questions on Senate Bill 153? Further questions? Seeing none, we'll close questions and move to action and or discussion. Action and or
Mr. Chair?
discussion. Yes, Representative Bandera.
I move to pass.
We have a due pass motion of Senate Bill 153 by Representative Bandera, second by Representative Baxter. Comments on that motion, Representative Bandera.
Thank you, Mr. Chair. I think it's important right now that with the issues that we have accessing good quality professional people in this particular area, that we don't tie their hands even further. I think this is a good common sense bill, and I ask for your support.
Okay. Further discussion or comments on the due pass motion of Senate Bill 153? Seeing none from the committee, I'm just going to make one quick comment. After some conversation this morning with LRC staff, my vice chair and others, on Senate Bill 153, I will be recusing myself of the vote or abstaining from any vote, but that just to avoid any sort of conflict of interest in this bill. So with that, what we have before us is Senate Bill 153, a due pass motion by Representative Bandera, a second by Representative Baxter. All those in favor will say aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representative Rayfelt.
Aye.
Fosness.
Aye.
Halverson.
Aye.
Jordan.
Aye.
Garcia. Emery.
Aye.
Pardon?
Aye.
Okay. Andera.
Aye.
Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter. Aye. Heineman.
Aye.
Mulder excused.
With that, having received a majority of vote of the committee, Senate Bill 153 will move to the floor with a due pass motion, and we can put that on consent. All right, with that, we have no more bills in front of us. We have 3 bills for Thursday. I think, just in case, we'll start at our scheduled time. We could probably start at 8 o'clock. We'll start at 8 o'clock on Thursday. With that, I will take a motion to adjourn. A motion by Representative Heineman, seconded by Representative Baxter. All those in favor will enthusiastically say aye. Aye. All those opposed will say nay. We are adjourned.
When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB, good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota legislature and in-depth reporting from peer. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB. Good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota legislature and in-depth reporting from peer. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder.
Good morning and welcome to Senate Commerce and Energy. I would like to ask everyone to please take a seat and have your phones turned to silent. If you plan on testifying today, please sign in at sdlegislature.gov. Press the people icon or link next to the agenda and fill out the form, or you can do this directly on your phone by scanning the QR code on the agenda above the podium. At this time, I'd ask the secretary to please call the roll.
Senators Melhoff, excused. Dibert.
Here.
Hone, excused. Carr, excused. Kobeck.
Here.
Larson.
Here.
Perry.
Here.
Peterson, excused. Crabtree.
Here.
Mr. Chair, we have a quorum.
Thank you. At this time, the chair would entertain a motion to approve the minutes of the last meeting, moved by Larson, seconded by Dibert. All those in favor say aye.
Aye.
Those opposed say nay. Minutes are approved. Just a reminder for testifiers to sign in at the back of the room there. If you don't know how to do it, looks like Lauren Pankratz will show you. Make sure you're wearing your badges. And testifiers, if you have handouts, please make sure they are distributed by the pages. At this time, I'd ask the pages to come on up, introduce yourself, tell us where you're from, and what your future plans are.
Good morning. I'm Ryler Stivix. I am a senior at Gregory High School, home of the Gorillas. I did this last year and I wanted to come back because of how much fun I had with you guys. And then my plans are to do the Build Dakota and go to Mitchell Tech for construction.
Good to have you back.
Good morning. My name is Hannah DeLine. I'm a senior at Mitchell Christian High School, and my future plans are to attend a 4-year university majoring in kinesiology with a minor in criminal justice.
All right, fantastic, guys. Thanks for being here. And being willing to serve for the next couple of weeks here. So just a reminder that all testimony and all questions are going to be addressed through the chair today. And with that, we'll go ahead and get started with our bills, just so that we can plan ahead of time. Our bill hearings will all be 10 minutes each for each side. So keep your comments inside the 10-minute range for proponents and inside the 10-minute range for opponents. We've got a shorter day and a longer floor session that we're preparing for. So if you would, please be mindful of that. And with that, I'll turn it over to the vice chair as we start HB 1119.
Thank you, Mr. Chair. So on our agenda is HB 1119, an act to modify provisions regarding directors serving on a farm mutual insurers board. Is there proponent testimony?
Good morning, Madam Chair, members of the committee. Casey Crabtree, Senator from District 8, which is Lake Minor, Kingsbury, and rural Brookings counties. Today we bring you HB 1119, and let me give you a little bit of background on this. D. Smith Farm Mutual Insurance Company of South Dakota operated independently for a majority of its history. Weather and market conditions made it difficult to obtain property reinsurance, forcing D. Smith Farm Mutual to retain a significant amount of property risk. In 2022, a series of weather events hit South Dakota between the derecho and hail events. D. Smith Farm Mutual had losses of over $65 million in 2 months. These losses significantly impaired D. Smith Farm Mutual's surplus despite reinsurance payments. To shore up its financial health, D. Smith Farm Mutual began looking for another mutual for potential affiliation. In the aftermath of the derecho, Goodville Mutual Casualty Company and D. Smith Farm Mutual began discussing regarding a potential affiliation. By the end of 2022, the Goodville Mutual Casualty Company and D. Smith Farm Mutual boards voted to approve the final affiliation agreement, and the combined group has thrived. In order to better facilitate the relationship, the companies wish to clarify that a member of an affiliate may sit on a mutual's board. The legislation seeks to expand the permissible number of board seats from 11 to 15. This is permissive and is not mandatory. The bill also incorporates a definition of affiliate from other portions of the insurance code to clarify the relationship. Better facilitating affiliate relationships allows our domestic farm mutuals to diversify their risk. With that, I'll stand by for questions.
Thank you. Further proponent testimony on House Bill 1119.
Madam Chair, committee members, Doug Abraham. I'm an attorney from Peer Registered Lobbyist for DeSmit Farm Mutual and DeSmit Insurance Company. Just want to briefly kind of walk through the mechanics of what House Bill 1119 does. There's really two changes. One, it increases the permissible members of the board of directors of a farm mutual insurer from 11 to 15. The minimum is 5. It doesn't change the minimum, and it doesn't mandate that you increase your numbers at all. It's completely permissive, and we aren't changing that. Currently, only members of the farm mutual insurer, so the insureds, the people actually insured by the farm mutual, can serve on the board. This would allow members of an affiliated insurer to serve on the farm mutual's board, and that makes sense because the affiliated insurer, through control, common control, or indirect control through an intermediary, has a financial interest in the performance of the farm mutual. Allowing board participation allows for oversight of that investment or risk. And next, I'd go to the second portion of it. We've brought in, after consultation with the Division of Insurance, a definition of an affiliate from a separate section of the code, so that we're defining what an affiliate means. And we've defined that. This is in another section of the code, the stock holding company section of the code for insurers. And that just means an entity that directly or indirectly through one or more intermediaries is controlled by or is under common control with the insurer at issue. And so that provides the structure for what occurred here. And the reason why farm mutual insurers have a little different and more restricted ability to raise capital versus stock holding companies is we can't go out and raise funds in the marketplace. Basically, we'd have to do a capital call through our members, or we'd have to go out and find other ways, like an affiliate agreement, to diversify that risk and enter into partnerships with other insurers. Farm mutuals are kind of unique in the sense that they typically have kind of a small footprint, as you might imagine from DeSmit Farm Mutual, primarily eastern South Dakota. When you look at a geographic standpoint and you have significant losses due to wind or weather events, that can hit particularly hard for an insurer that has a small geographic footprint. affiliation agreements like this allow for that diversification of risk across a greater geographic footprint. So it allows them to better manage their risk. And that has been what's been ongoing since this occurred towards the end of 2022. It's been a situation that's worked exceptionally well, and we believe will continue to work well into the future. This kind of catches up with that practice and allows for that continued oversight. I'll stand by for any questions and pass it on to Mr. Schlechter to submit.
Thank you. Further proponent testimony on House Bill 1119.
Thank you. My name's Steve Schlechter, and I'm personally testifying on House Bill 1119. A little bit about myself. I joined DeSmet Farm Mutual Insurance Company in South Dakota 18 years ago and currently serve as the Chief Operating Officer for the company. As was previously mentioned, DeSmet and Goodville officially affiliated on January 1st of 2023. What I think might be helpful for the committee is to understand who Goodville is and why we chose them to partner with. After it became apparent that the May 12th, 2022 derecho was going to develop into a capital event for the company, we chose to pursue a long-term solution to this challenge. We actively went in search of a partner, one in which both parties would benefit and become stronger together. After vetting a number of interested companies, it became obvious they all had the tangibles that we were looking for, but only Goodville had the attitude, culture, and values that so closely match our own. A little trivia here, Benjamin Franklin, who many consider the father of American insurance, was responsible for the formation of the first insurance company in America. The insurance company was, and I quote Mr. Franklin, a mutual company apart from all views of separate gain or interest. Putting that simply, a mutual company, unlike a stock company, is owned by its policyholders, and their interests are at the forefront of the company's operations and decision-making processes. I refer to this as a mutual mindset. Goodville operates with a mutual mindset, just like DeSmet Farm does. As a mutual company, our job, our whole purpose, is to take care of our members in a responsible and sustainable way. Goodville's ethos mirrors our own. That's who they are, and that's why we chose them to partner with. It was a good move, a smart move, an opportunity to become stronger together and to continue our 110-year history of serving South Dakota from South Dakota. Thank you.
Thank you. Further proponent testimony on House Bill 1119.
Apologies to interrupt, but us online cannot hear what's going on.
Just 1 second. We'll see if we can fix the technical difficulty.
She fixed it, I think.
Okay, go ahead. Let's try now.
Okay. Good morning,
Yes,
Madam
thank you. We can
Vice
hear now.
Chair.
Thanks for letting us know. Yes, go ahead. Sorry about that.
Good morning. Members of the committee, my name is Craig Mattson. I'm a registered lobbyist for the South Dakota Insurance Alliance. We represent about 87% of the property and casualty companies in South Dakota. Not all of our members very few of our members are farm mutuals. However, we rise in support of this bill because we think that they do a very good job in serving underserved markets. We need them. We all need them. And so we think this bill merely makes perfect sense, and we hope that you can support it. Thank you very much.
Thank you. Further proponent testimony on House Bill 1119. Any testimony in the room? Any testimony online? Seeing none, we'll open it to opponent testimony. Is there any opponent testimony on House Bill 1119? Any testimony in the room? Nothing online? With that, I'll waive rebuttal and open it up to committee questions. Senator Colbeck, did you have a question?
No question, just a discussion. I know exactly what this bill is talking about. I mean, there were some times when I've been on certain other boards and when you have to go out and raise capital, you have to make some adjustments, and I think this is a good bill. I'll motion do pass.
Comments on your motion, or was that was your comment?
That was my motion. I'm sorry. I started out with a discussion. I moved right into a motion.
Okay. So I just want to make sure there are no other questions from the committee. And if there are, I guess you can express them at this time as comments on the motion. So I do have a question, and I'll just place it here in this spot since this is where we are. But I'm wondering about what the percentage of the partners will be on the board and what the percentage of members will be on the board. Go ahead. We're a little bit mixed up in our order here, but let's go ahead if you wouldn't mind answering that
Madam
question.
Chair, I'm going to phone a friend.
Thank you.
Sure, that's a very good question. Their practice is, or the Goodville Group practice is.
Introduce.
Oh, I'm sorry. I'm Steve Schlechter. I'm personally testifying on HB 1119. To answer your question, the current practice is to use a pro rata based on direct written premium. So the representation on the board is based off a pro rata of the direct written premium of the group.
So can you just explain that, how that is actually implemented in terms of numbers or percentages, but.
Sure. Currently, we're sitting at about 80 million in direct written premium. The group is sitting at 460 million. That equates to roughly two board members of the current size of the board of the Goodville Mutual Insurance Company's board, or Goodville Mutual Insurance Group's board.
So 2 members of the board would be actual insureds?
Would be, yes.
And the others would then be of the company?
Of an affiliate's insureds, yes.
And how many total board members did you say?
I believe there's currently 9.
So you'd be going from a full board of members to a board that would be in a significant minority of members?
Yes.
And are members okay with that?
We are a minority currently. I mean, as part of the affiliation agreement approved by the Division of Insurance, Goodville, to be a member of a farm mutual, you have to own a policy with the farm mutual. And so currently 5 members of the Goodville company have policies with DeSmet Farm Mutual, and that is how they are holding the majority of the board. There's 5 Goodville members of the Goodville staff, or members of the Goodville leadership that are members of the DeSmet Farm board currently. There are 4 remaining directors that are original South Dakota directors.
Okay, so you'd be going from 4 to 2?
Correct.
Okay, and are the members okay with that?
That has to be, our annual meeting is coming up in April, end of April, or end of June, I'm sorry.
Okay. Okay, thank you. Further questions from the committee? Okay, well, we do have a do pass motion in play, so I would ask for further comments on that motion. Any comments on the motion?
Need a second.
Oh, do we have a second? Yeah. Okay. Yeah, okay. So seeing no further comments, we will take action on the do pass motion for House Bill 1119. Those in favor say aye, those opposed no. Madam Secretary, please call the roll.
Senators Melhoff,
Aye.
Dybert,
Aye.
Hone, excuse, Carr, excuse, Kobeck, Larson, Perry,
Aye.
Peterson,
Aye.
Crabtree.
Aye.
Mr. Chair, we have 7 yeas and 2 excused.
With that, House Bill 1119 will go to the floor with the do pass motion. If there's no objections, do we want to put this on consent? Yes. Okay, all right. This will go on consent then.
Next up is House Bill 1101, an act to prohibit an insurer from declining or limiting life, disability, or long-term care insurance policies based solely on an individual's status as a living organ donor. We'll take proponent testimony at this time. Welcome, Senator Davis.
Thank you, Mr. Chair, members of the committee. Like you said, Senator Sidney Davis, District 17, bringing you today House Bill 1101. This is the Living Donor Protection Act. It's a short, targeted bill with a very specific purpose. This is to ensure South Dakotans who choose to become living organ donors are not penalized by long-term care insurance companies simply because they stepped forward to save a life. South Dakota currently has no statutory protection for living organ donors when it comes to life, disability, or long-term care insurance. Because of that policy gap, our state received an F rating on the American Kidneys Fund most recent Living Donor Protection Report Card. That rating does not reflect the lack of generosity in our communities by any means. It just reflects a lack of safeguards in our law. HB 1101 is intentionally narrow and straightforward. This bill does three things. First, it prohibits life, disability, and long-term care insurers from denying or limiting coverage solely because an individual is a living organ donor. Second, it prevents insurers from conditioning continued coverage on someone agreeing not to donate an organ in the future. And third, it makes clear that donor status alone, without additional actuarial risk, cannot be used to raise premiums or otherwise discriminate. This bill does not regulate health insurance, it does not change underwriting standards, and it does not create a fiscal impact for the state. It simply draws a clear line that donor status by itself is not grounds for insurance discrimination. This is not a novel approach. Similar protections are already in place in more than 35 states, including several of our neighbors. Those laws that have been in effect for years without reported premium increases or unintended consequences. This policy is supported nationally by transplant advocates and the life insurance industry alike because it preserves actuarial integrity while removing an unnecessary barrier to donation. You'll hear shortly from some witnesses who can speak in detail why this matters, and we'll also hear from the American Kidney Fund State Policy Associate Director on the impact of these protections. As you can see, I gave you plenty of handout information to reference as well. Just as a reminder, this is a short, focused, proven, no-cost bill. It protects people who do something extraordinary without creating new mandates or new risks. I respectfully ask for your favorable consideration, and I'll stand by for questions. Thank you.
Thank you, Senator. Further proponent testimony on House Bill 1101. Any further in-person proponent testimony, we'll take in-person first, and then we'll go to online. Welcome.
Good morning, Mr. Chair, committee members. My name is Marcia Holtman, and I'm here today representing myself as a citizen of Hughes County. And for some reason, I'm really nervous.
You've been in here before. I don't know why you'd be nervous today.
I am here today representing myself as a living organ donor. I'm asking for your favorable consideration of House Bill 1101. 16 months ago, I donated my kidney to a stranger. To this day, I still don't know the recipient's name or anything about them, but I pray daily that he or she is doing well. As a living donor advocate, I've shared my story with pretty much anyone who wanted to listen, and quite a few people who probably didn't want to listen. And today, I'm here to share just a tiny bit of my journey with you. As a donor, the screening and decision-making process is very intense, and I asked myself endless questions and had many things to worry about. I asked questions like, what is my motivation for doing this? What if my child needs a kidney in the future, or my husband, or my sister? Would my own health be impacted? Would my life expectancy be shortened? Would my job be jeopardized? But the one question or worry that never crossed my mind was, could I be denied insurance in the future because of my decision? I never once considered this, which was my ignorance, but I contend that it's not something that any living donor should have to worry about. Passage of House Bill 1101 is a reasonable protection that would make life-changing decisions one answer easier. And why is this so important? because the need to remove barriers to donation is so great. At the time of my donation, there was one more important question. Did I want my kidney to go to someone on the national registry, or did I want to keep it closer to home and have it go to somebody on the smaller, more localized Avera registry? Well, as a South Dakota fourth-generation farm girl, I wanted to keep it as close to home as possible. So I decided to go with the Avera service area. And there were 43 matches at that time for my kidney alone. 43 individuals awaiting donation, and I could only help one. The bill before you may make a difference in someone's, yours, decision to save a life through living donation. I encourage you to please vote yes. Thank you.
Thank you. Further proponent testimony on House Bill 1101. Further in-person proponent testimony.
Good morning, Mr. Chairman, members of the committee. Lauren Pankratz, registered lobbyist for an organization called LifeSource. So LifeSource is what is called the federally designated organ procurement organization. And they cover North Dakota, South Dakota, Minnesota, and part of Wisconsin. We have affiliate agreements with 200 or 300 hospitals, and we are in the organ recovery business. We do not do we're not involved with living organ transplants, but we look at this as an opportunity to be able to have a healthy and needed discussion about organ donation, whether that be a living organ donor or family members that are involved with organ recovery. And so we wholeheartedly support any conversation that moves organ donation forward. So we would urge your positive vote on House Bill 1101, I believe it is. Thank you.
Yes, sir.
I'm trying to retire, you know.
I heard that. Further proponent testimony on House Bill 1101.
Good morning, Mr. Chair, members of the committee. My name is Jacob Parsons. I'm a registered lobbyist on behalf of the South Dakota Association of Healthcare Organizations, representing all the nonprofit hospitals in South Dakota. And in this case, we do have a couple of our hospitals in Sioux Falls who perform some of these procedures. And so I just wanted to throw out there that since the Living Kidney Donor Program, its inception in 2020, in Sioux Falls alone, there have been 445 living donors who have donated their kidneys. We just want to make sure that there's no additional barriers for the folks that want to do that, such as Secretary Holtman back here. So with that, we'd ask for your green vote. Thank you.
Thank you. Any further in-person proponent testimony on House Bill 1101? Seeing none, we're going to move to remote testimony online here for House Bill 1101, Dominique Lavin. Dominique, can you hear us?
I can. Can you hear me?
Yes, go ahead.
All right. Hello, Mr. Chair and committee members. Thank you for the opportunity to testify. My name is Dominique, and I am a living organ donor. I have been fortunate to have been born and raised in our great state of South Dakota. Today, I would like to tell you about my donation experience. I was never the person you'd expect to become a living organ donor. I hated needles and couldn't stand the sight of blood. But in 2015, everything changed. My son was delivered emergency C-section, and I lost a significant amount of blood during surgery. Without the generosity of strangers who donated blood, I would not have survived. Once I recovered, I made the decision to pay it forward and began donating blood regularly. After a few years, donating blood no longer felt like enough. I wanted to do more. During that time, I watched a high school friend share her experience donating a kidney to her husband's uncle. Both were thriving. I spent months researching living kidney donation, long-term outcomes, survival rates, risk, and how donation would affect my husband and our 2 young children. I joined online support groups and read firsthand accounts from donors across the country. What I learned during my research, thousands of living kidney donors happen every year. and most donors go on to live healthy, normal lives. Still, this was not a decision I took lightly. Living donation is not for everyone, nor should it be. It requires exceptional physical health, emotional readiness, family support, and the ability to withstand an intensive medical evaluation. Once I decided to move forward, the process was long and demanding. I completed extensive medical questionnaires, dug through generations of family history, and spoke with nurses, psychologists, living donation advocates, and physicians. I traveled to Minneapolis for days of testing, blood work, imaging, scans, and evaluations. Every test mattered because protecting the donor's health, my health, was their top priority. Only after the transplant board reviewed my entire case was I approved, and in December of 2021, I was officially placed on the Living Donor Registry. In January of 2022, I had a match. All I was told was that the recipient was a 29-year-old young woman. They immediately began making arrangements, including requesting 4 weeks off of work to recover. I was fortunate to work for a small company that chose to hold my job for me. South Dakota does not require them to do so. A few days before surgery, I posted in a Living Donor support group asking about my transplant team. A woman reached out, and based on timing, we realized I was donating to her daughter. She was a young mother of 2, tethered to dialysis multiple times a week after her kidneys had failed. The doctors told her it was because of her back-to-back pregnancies. Her life had been put on hold. This transplant would give her back, wouldn't just give her back her kidney, it would give back her independence, her future, her ability to fully be present for her husband and 2 toddler-aged children. On February 16th of 2022, my surgery went smoothly. My kidney began working immediately. Within hours, her numbers improved. After 2 nights in the hospital and a few quiet days recovering, I returned home. Nearly 4 years later, I've had no complications and rarely remember I even donated. What I fully did not understand at the time was that living donation could also affect access to life disability or long-term care insurance. As a wife and mother of 2 young children, those risks do not just affect me, they affect my family. South Dakota prides itself on supporting families' personal freedom and doing the right thing. We should not ask people to shoulder unnecessary risk for an act of kindness. This is why the Living Donor Protection Act is so important to me. This bill would ensure that individuals are not penalized for discriminating against by insurers simply for choosing to donate an organ. This issue is not abstract. Someday the person in need could be your brother, spouse, or your friend. Thank you.
Thank you. We're a little past our 10-minute timeline, but Bree Schmidt, if you have some comments, please go ahead as proponent testimony. Just try to keep them brief.
Absolutely. Thank you, Mr. Chair and members of the committee. My name is Bree Schmidt. I am the Associate Director of State Policy and Advocacy at the American Kidney Fund, and I am here in support of the 2,000 South Dakotans living in kidney failure. You've heard numerous patient testimony, living organ donor testimony. Currently, 1 in 7 adults have kidney disease, and every day 13 people die waiting for a kidney transplant. And so this HB 1101 removes that barrier. It also, organ donation makes economic sense. So a successful kidney transplant often allows someone to return to work and live without dialysis, which is 4 to 5 times a week, lasting over 4 hours, and averages around $100,000 per patient annually. In contrast, transplantation, though expensive upfront, reduces those long-term healthcare costs and allows recipients to return to work, generating savings for both families and state programs. So I just want to thank you, Senator Davis and Rep. Uribulk, who have sponsored this, have given you great testimony and understanding of the bill. If you have any questions, I'm here for questions. Thank you.
Thank you. Last call for proponent testimony. Seeing none, we'll move on to opponent testimony. Are there any opponents to House Bill 1101? Last call for opponents for House Bill 1101. Seeing none, we're going to waive sponsor rebuttal, and we are going to move it on to committee questions, discussion, and or action on House Bill 1101. Senator Colbeck.
Yeah, I just have one quick question for the Prime.
Go ahead, Senator.
When we talk about decline or limit coverage, under anything. We're just talking about these specific donors, right? We're not talking about anything else. It has to be that they've already donated or they're going to donate.
Go ahead, Senator.
My understanding they have to be a living organ donor.
And that would be post.
I would also say that, another thing the bill does, it prevents insurers from conditioning continued coverage on someone agreeing not to donate an organ in the future as well.
Okay.
Does that help?
Yep, it does.
Okay.
Thank you.
Further committee questions, discussion, and/or action on House Bill 1101. Senator Peterson.
Mr. Chair, I move do pass.
Second.
We have a do pass motion made by Senator Peterson, a second by Senator Colbeck. Comments on the motion, Senator Peterson.
Well, I think we've had very compelling testimony, and I think that these folks are doing an amazing thing and deserve the protection of being able to keep their insurance.
Any further comments on the do pass motion, Senator Colbeck? Seeing none. Any further comments, Senator Larson?
I'll be voting yes on this motion, and I just want to thank the sponsors for bringing this. I mean, the stories that we have about people making pretty much the ultimate sacrifice, and I love how we say we're keeping our kidneys local. That's kind of cool too. So I just really appreciate everybody coming forward and sharing their stories, and this is a really common sense bill for people who are giving a big sacrifice. Thank you.
Further comments on the do pass motion, Senator Perry? Nope. All right, the chair would just close. I know we have some high school students in here. You're seeing most folks wear black because today is crossover day. It means a lot of bills meet their demise one way or another. However, today in this, we get a feel-good bill, which is pretty good timing of that. And the good secretary almost made me cry up here watching that. So I think this is a great thing to support, and I'm shocked that we're in a situation where we have to do this. You'd think this has already be done. But thanks for finding this, and thanks for doing the good work. With that, the secretary, please call the roll on the do pass motion.
Senators Melhoff,
Aye.
Dybert,
Aye.
Hone, Carr, excused, Colbeck,
Aye.
Larson,
Aye.
Perry,
Aye.
Peterson, Crabtree.
Aye.
Mr. Chair, we have 8 yeas and 1 excused.
After receiving a unanimous number of votes, House Bill 1101 is hereby deemed passed, and unless there's any objections, we will place that on the consent calendar. All right. Moving on, House Bill 1096, an act to allow for the direct creation of a limited liability limited partnership. Representative Mortensen.
Good morning, Mr. Chairman, members of the Senate Commerce Committee. My name is Will Mortensen. I represent District 24, which you are sitting in. It encompasses most of central South Dakota. I bring to you House Bill 1096, which is really it's a niche issue that will save the people of our state a little bit of money and a little bit of headache, and I'll explain to you just how it'll do that. When you go to form an entity, you can form a corporation or an LLC or a partnership, and including a limited partnership. Really the sine qua non of a limited partnership is that you've kind of got managing partners and silent partners in it. All that's kind of boring and not really all that germane to why this bill is important. You can also create what's called a limited liability limited partnership. That's been true in this state for decades. That provides additional liability shields for the general partners. We're not changing anything about the way that those things function, not the extent of their liability, not how you participate as a limited or a general partner. What we are changing in this bill is how those are created. Currently, and I set up a lot of these for farmers and ranchers around here, a lot of people choose to hold ag land in these entities because you can have off-farm and on-farm family members owning this partnership together, keeping this joint asset together. If you're going to create one today, the state law requires an expensive two-step process, and under this bill, we would allow a cheaper one-step process. So what is the current two-step process? Right now, if I have a client who wants to set one of these up, they will come to me. We will have to file the entity as a limited partnership and pay the $150 filing fee. I will also have to draft them a limited partnership agreement, which is often a pretty long document. It deals with how you get in or out. It deals with how the incomes and expenses are allocated, when money is distributed, how the management goes. So these are pretty long documents. So you have to do all that. And then if you're going to create a limited liability, limited partnership, you have to do a conversion. And so it's another $125 filing fee to convert from being a limited partnership to a limited liability, limited partnership. And then they enter into the triple LP agreement that contains most of those same terms, and it's usually a 20 or a 30-page document in order to create one of those. And I just thought my clients are frankly paying more than they should to the Secretary of State's office in fees, and they're paying more than they should to me to draft these documents. We should just allow people and just write in the title, the direct creation of a limited liability, limited partnership. That is, you file the certificate of limited partnership, or rather the certificate of limited liability, limited partnership, with the Secretary of State directly. So what does that save them? It saves them the $125 fee for conversion. It saves them the fee they'd have to pay their attorney, me or someone else, to set up that first step. It just makes sense in a very small way. And again, I'll admit this is a niche. This isn't a big issue, but this is a small way where we can save good people of this state some money in filing fees they shouldn't have to pay, and in attorney's fees, frankly, they shouldn't have to pay. I ran this bill by the state bar. They sent it to their business law group. I got good feedback from those folks. They pointed out that a good number of other states already allow the direct creation. They all started out having to do this two-step. A lot have already done, moved to this direct creation. I also sent to the Secretary of State's office. They asked me for an amendment on the House side that I put on that delays the implementation of this to January 1 of next year, because they're standing up a new electronic process that will allow for the electronic creation of these. And they just said, if we don't want to have to pay a programmer $30,000 to do this immediately, would you just let us fold it into our current process? I said, absolutely. Otherwise, they said this is plumb manageable. So again, small bill that'll make life a little bit cheaper on farmers and ranchers and other folks setting up entities like this.
Thank you. Further proponent testimony on House Bill 1096. Any further proponent testimony? Seeing none. Is there any opponent testimony to House Bill 1096? Seeing none, we'll close opponent testimony. We will waive sponsor rebuttal. We'll move on to committee questions on House Bill 1096. Senator Peterson.
Thank you, Mr. Chair. Question for the prime sponsor, since he's the only one in the room on the bill.
There's nobody else to ask it to.
Right.
Unless one of these high school kids wants to take one. Go ahead, Senator.
So should we do something like this for corporations as well, limited liability corporations?
Mr. Those allow them to be directly created. I mean, if you want to go form a corporation or an LLC, a limited liability company, you can just directly create one of those. You don't have to create a company and then convert it into being a limited liability company. So this is really the only area that requires this, I would say, unnecessary two-step process.
Go ahead, Senator.
So is this just part of the law that didn't get changed, or why do we have different processes for both?
Go ahead.
Sure. I wish I'd have done a little bit more historical research, so this is going to be a bit of speculation. My assumption is that just like LLCs didn't used to exist 30 years ago, Wyoming was the first one to allow the creation of LLCs. We were pretty quickly thereafter. My assumption is that these limited partnerships have existed as an entity for a long time. And then somebody said, well, why can't we have a limited liability, limited partnership? And so then rather than allowing this direct creation, they just said, well, anybody who wants to convert to become one can. And at that point, I would say maybe they weren't as comprehensive or circumspect as they should have been. That's my assumption how that went, but I didn't dig that deep.
Thank you. Further committee questions on House Bill 1096. Any further committee questions? Seeing none, we'll move on to committee discussion and/or action. Senator Dybert.
I'd move do pass.
We have a do pass motion by Senator Dybert. Do we have a second? We have a second from Senator Melhoff. Comments on the motion, Senator Dybert?
I think the testimony stands by itself.
Any further comments on the do pass motion? Seeing none, the motion in front of the committee is a do pass made by Dybert, seconded by Melhoff. Would the secretary please call the roll?
Senators Melhoff.
Aye.
Dybert.
Aye.
Hone. Aye. Carr, excused. Kobeck. Aye. Larson. Aye. Perry.
Aye.
Peterson. Aye. Crabtree.
Aye.
Mr. Chair, we have 8 yeas and 1 excused.
Thank you. After receiving a unanimous number of votes, House Bill 1096 is hereby deemed passed, and we will place it on the consent calendar unless there's any issues with the committee. Seeing none. All right. Next up, and just a reminder, we're going to keep this to the 10 minutes and 10 minutes for both sides. This is House Bill 1194, an act to require that the Cosmetology Commission credit work experience for educational hours for certain out-of-state licensure applicants. Welcome.
Thank you, Mr. Chair and committee members. Representative Tessa Schwans, District 9. Today, I would like to introduce 1194A, an act to require the Cosmetology Commission credit work experience for educational hours for certain out-of-state license applicants. This bill was brought forward due to the inconsistencies in current language and to update that language and create more clarity for those out-of-state licensees moving to South Dakota. With South Dakota becoming a destination for out-of-state individuals and families to move to, it's important to have a streamlined approach and create an atmosphere to get to work while still staying within the application requirements and standards of the industry. The amendment added was to give power to the commissions and parameters by adding territory to the section within Section 2. Within Section 3, it adds territory and cosmetology related to fill the requirements in question. It reiterates work experience hours may not be credited for more than half of the hours of education required for the license. The Cosmetology Commission and the Department of Labor realize that there is a need for language updates and are willing to add new measurements through administrative rule, which is why this process started and exists here today. The reciprocity bill is a right-to-work bill that supports out-of-state licenses to comply with our structure, yet clarifies language that was in need of updates without adding additional costs to the commission or our licensees. I will stand by for questions and will let the proponents tell their own personal stories. Thank you.
Thank you. We'll take further proponent testimony on House Bill 1194. Further in-person proponent testimony. Welcome.
Good morning, Mr. Chair, members of the committee. My name is Daylin Botmal, testifying on behalf of myself. I want to thank you all for taking the time to listen to my story and giving me the opportunity to tell you why House Bill 1194 is going to be important. I want to give you a little bit of my background. I moved to the state 9 months ago, filled with excitement and hope to build my life right here in Pierre and become a valued member of this community. I am a licensed cosmetologist from the state of Oregon with 2,300 hours of educational requirements and more than 6 years of working in the field. In February of 2025, I applied for a reciprocity cosmetologist license right here in South Dakota. At the time, I figured there wouldn't be any issues given that I am well over the minimum requirement of educational hours and have had a license in good standing for more than 6 years. Instead, I was met with a consistent denial over a period of 7 months due to clerical issues written in the current laws. Eventually, after fighting for my reciprocity, I consented to return to school despite the fact that I was already 800 hours over the minimum requirement. I spent months proving in many ways that I was more than qualified to work in this state and fighting for my passion, all to sadly be denied due to poorly written laws and being misunderstood by the past director that was implementing them. I would like to give you some examples of why I believe that this law is being misunderstood. After my fight had gone public, I was contacted by a fellow cosmetologist located in Spearfish, South Dakota. She is also a salon owner, and she came from the state of Oregon in 2023. She has the same qualifications as me, the same educational requirements, and she was given a reciprocity license with no issues. While only 2 years later, I come to the state and I was met with months of denial, emotional turmoil, and financial stress. I believe that this shows you that there are inconsistencies in our reciprocity laws and that our current process is broken. House Bill 1194 will clarify those issues and give assurance to other qualified cosmetologists moving to this state. I want to thank you for taking my story into consideration, and I believe that House Bill 1194 will allow other passionate cosmetologists like myself to come to this state and work without being met with such turmoil. My hope is that this bill allows that what happened to me never happened to anyone else again.
Thank you. Further proponent testimony on House Bill 1194. Further in-person proponent. I've got one online here.
Mr. Chair, committee members, I'm Zoe Hiller. I'm testifying on behalf of myself. I'm the owner of a cut and style here in Pierre. I have 40 years of experience and a former member of the Board of Cosmetology Commission. You've heard Dalen's story. Let me tell you about mine, the salon owner's side. I talked to Dalen first time in March. She told me that she had applied for a license in February. I was confident that she would get her license, no problem. I was like, move here, you'll start work, no problem. We're a busy salon. You make some good money. In April, Dalen started working for me as a receptionist. It was hard to watch her, a qualified stylist, not being able to do the work that she was trained to do and earn the wage she deserved. From the executive director of cosmetology, Dalen only kept hearing, your license isn't equivalent. Our salon is very blessed that Dalen chose to stay and fight the fight. But the struggle was real, the sadness and depression from not understanding why. All I could do was apologize over and over for our state. All Dalen wanted to do was work as a cosmetologist. Tired of getting nowhere with our state, in May, Dalen relented to go back to school. 140 hours, 3 weeks, would make her equivalent to South Dakota. End of August, the battle was over, and Dalen was a licensed cosmetologist in the state of South Dakota. She's an amazing stylist. When I was a member of the Cosmetology Commission, I worked with 2 executive directors. One of the executive directors was with the Board of Cosmetology for 12 years. Through our struggles, I reached out for her guidance after Dalen's application was denied multiple times. She was surprised with our situation, indicating that South Dakota had never previously denied any applications from Oregon that she knew of. This brings me to the very reason I am here. Something is wrong, badly wrong with this law, and we need legislative clarity. The proposed changes to the House Bill 1194 are crucial so that whoever is the executive director, they cannot misinterpret the law again. No out-of-state cosmetology application should have to wait 6 months to get a license, especially if they are educated and have work experience behind them. Thank you.
Thank you. We'll take further proponent testimony. Any further in-person proponent testimony on House Bill 1194? Seeing none, we're going to go to online. Wendy Johnson. Wendy, are you there?
I am. Can you hear me?
Yes, we've got you. Go ahead, Wendy.
Okay. Chairperson and members of the committee, thank you for allowing me to speak today. My name is Wendy Johnston, and I'm here from the perspective of cosmetology school owner who works directly with applicants navigating reciprocity in South Dakota. I want to begin by saying something very important. I believe in maintaining a gold standard that South Dakota is known for. I have stood before the South Dakota House of Representatives Committee advocating for increased education when public safety demands it. I do not support lowering standards we already have in place. What I'm asking for today is clarity and consistency. Over the past several years, I have personally worked with multiple cosmetologists, estheticians, and nail technicians relocating to South Dakota who were licensed in states requiring more hours of education, significantly more than many programs nationwide. These are seasoned professionals who have completed more training than what South Dakota requires for initial licensure. Yet some of them have been told they must return to school and pay for additional hours. Imagine explaining to a licensed professional, someone who has already invested thousands of dollars and considerable time into their education, that they must enroll again, pay registration fees, tuition fees, housing costs for some, travel expenses for others, not because they lack competency, but because our statutes are vague and open to interpretation by whomever holds the position at the time. These individuals often move here for military transfers, family reasons, or economic opportunity. Instead of being welcomed into our workforce, they are met with uncertainty, unexpected costs, and delays that can stretch for months. I have seen similar challenges with nail technicians. For example, we have experienced nail techs who have safely and competently used an electric file for years in their previous state. However, because their state does not specifically list electric file certification on their face of the license, even though it was included in their training, not to mention the years of salon experience, they're required here in South Dakota to take additional continuing education. I want to add that I've also experienced similar situations with estheticians coming into the state and the certification of performing microdermabrasion and other similar treatments. Again, this is not about safety standards. If someone has not been trained, they absolutely should be required to complete education. But when someone has documented training and experience, yet must repeat coursework solely because of how another state structures its license documentation, it feels less like public protection and more like procedural inconsistency. From a school's perspective, this puts us in a difficult position. We must create an enrollment plan for licensed professionals without clear statutory guidance. We must maintain our compliance with our policies, the Department of Education, and our accrediting agency, NACAS, therefore collecting, in my opinion, unfair tuition and registration fees, which are required written into our policies. We become intermediary between the applicant and the commission's interpretation.
Wendy, we're
And
nearing
we
it.
often cannot-
Wendy, we're sorry to interrupt you. We're nearing in on our time, so if you want to
Okay.
help us wrap up there.
Yes. I just want to state again that I've dealt with this a lot. Daylin happened to be one of mine personal, and this bill will help to clarify this information and make the rules and the laws more consistent throughout. So thank you for your time.
Thank you. Any further proponent testimony? Seeing none, we're going to go into opponent testimony. Is there any opponent testimony to House Bill 1194? Opponent.
I know.
Okay.
Thank you, Mr. Chair. Representative Schwanz. I know, that's very weird. I know. I want you guys to understand, number one, that this topic is very important. This topic is very important to the future workforce in South Dakota and the South Dakota Cosmetology Commission. It needs to be said that I will continue to fight for our licensees in South Dakota and for the safety and standard issues that they face. I also want the committee to know that due to the collaborative efforts made on behalf of the Department of Labor, Cosmetology Commission, and the licensees and the proponents today, I will trust that the changes needed will be added through administrative rule, which will allow future flexibility to remain within the Cosmetology Commission, which is where it belongs. This story is a reminder that misinterpretations are no longer a standard for our licensees, and I'm asking for 1194 to be tabled.
Mr. Chair?
Hold on one second. We're still in opponent testimony. So is there any further opponent testimony to House Bill 1194?
Mr. Chair,
Go
members
ahead.
of the committee, Jennifer Doubledy. I am the attorney for the Cosmetology Commission and employed by the Department of Labor. After hearing Representative Schwann's recommendation to table, I am in agreement with her that we can table this.
All right. Any further opponent testimony to House Bill 1194? Seeing none, we're gonna go ahead and waive the sponsor rebuttal. but we are gonna open it up for committee questions.
I'm just a question or discussion?
Let's go with questions.
Yeah, I'm good. I just have a little discussion.
Okay, further questions, Senator Peterson. Then
Mr.
Senator
Chair, when it comes time for action, I would like to, but go ahead if there are other questions.
Senator Pyre. I was going to go to and/or action. All right. Well, we're ready then. We'll go on to committee discussion and/or action.
Mr. Chair, I move do pass.
Second.
Discussion on the motion.
I would offer no.
Okay. We'll just we'll slow down here just a little bit. We have a do pass motion that was made by Senator Peterson, a second by Senator Melhoff. We have a substitute motion being offered by Senator Perry. Go ahead with the.
And that substitute motion is to table the bill.
We have a substitute motion from Senator Perry to table the bill with a second from Senator Dybert. Comments?
We really can't comment. I'm sorry, we can't comment.
Yeah. Okay, we'll go back. We'll go back to the original motion, and then we'll come back to that one. So, go ahead on the original motion, which was do pass by Senator Peterson.
Thank you, Mr. Chair. Well, I think the sponsor's done an excellent job of shepherding this through the process. I think that there have been significant issues, and I think that we are better off to handle things through statute than administrative rule. I feel like when there are changes made to administrative rule, the the whole legislature is not directly involved. And when we pass statutes, we are directly involved. And I think that that's important. I think that's important for accountability. We just passed two really important bills off the Senate floor almost unanimously. One was unanimous relating to rules and overreach and overregulation, and I think a lot of that happens by administrative rule. So I think that we should go ahead. Oh, and one other thing I will say is this passed off the House floor like 64-1 or something like that. So I would recommend do pass, and also I think we should have an emergency clause on it.
Senator Melhoff.
Thank you, Mr. Chair. So I'm not without some prior knowledge of this situation. I actually tried to intervene on Dalen's issues. I went to the Cosmetology Commission, I went to the Secretary of Labor, and I was unable to move the needle even a little bit. So I have a few trust issues on allowing the administrative rule process to fix this.
Senator Colbeck.
I'm in agreement with Senator Melhoff, Senator Peterson. I hope we don't table this bill.
Senator Hone.
Thank you, Mr. Chair. I'm in agreement as well. In fact, I'm really shocked and very disappointed for what Dalen has had to go through. This is really, it just makes me very upset. And I agree with Senator Peterson that there should be an emergency clause on this as well. So thank you.
Further comments? Any further committee discussion?
What about emergency clause?
Are you considering the second substitute motion now?
I think that we've had an opportunity to discuss. And thank you, committee, for being patient. This is the first time I've had a proponent be an opponent, and so we are certainly in a different territory. With that said, I think I know what the motion's going to be from over there. So one of the things that I would suggest here, just briefly, is I've never seen that done before, and I've never seen the table motion coming on something that was moving here in the way it was. I would assume that there was some sort of agreement that was made, and when the prime sponsor asked for that, I'm inclined to honor what the prime sponsor is wishing for. So, Senator Hone.
Can I make a motion to move the amendment? Oh, that was adopted. Oh, yeah.
Mr. Chairman, point of order. We had a motion and a second on the floor. I'm offering a substitute motion to table this.
Yes. We will move with the substitute motion. Go ahead with what the substitute motion is, Senator Dybert.
I would move to table this.
We have a motion. We have a substitute motion that was made by Senator Dybert and a second by Senator Perry to table. Those are not. That is a non-debatable motion. So in front of you is the motion to table. Would the secretary please call the roll?
Senators Melhoff,
No.
Dybert,
Aye.
Hone,
No.
Carr,
No.
Colbeck,
No.
Larson,
No.
Perry, Peterson,
No.
Crabtree.
Aye.
Mr. Chair, we have 7 noes and 2 yeas.
The substitute motion to table is therefore defeated. Three. Terry will correct the record there. So the substitute motion to table has failed, and we are back to a do pass motion now. Senator Hone.
Thank you, Mr. Chair. I'd like to move Amendment B.
Amendment. Can you give me the letter on that again, Senator?
B as in Bravo.
B as in Bravo. Has that been posted? Okay. Amendment B in Bravo has been posted. Comments on the motion to, is there a second? Second by Senator Melhoff. Is there comments on the motion, Senator Hone?
Thank you, Mr. Chair. Well, you know, as we heard from testimony on the delay and how it affects livelihoods, I think we need to push this forward.
Senator Dybert.
Point of order. We have a motion and a second on the floor. I don't know if we can move an amendment after the motion's been made.
It's a substitute motion now. Yep, and the previous one had failed. So we have a motion to amend that was made by Senator Hone, seconded by Senator Melhoff. Any further comments on the motion to amend? All those in favor of the motion to amend, say aye.
Aye.
All those opposed, say nay. The bill is amended. Further comments or a motion? Go ahead.
Mr. Chair, I thank the good senator for the motion on the emergency clause. I think these good folks have been without work for way too long. And South Dakota, we're open for opportunity, we're open for business, and we need to make sure that that happens and happens quickly. So I'm in full favor of a do pass motion with an emergency clause.
All right. Any further comments from the committee? Senator Dybert, go ahead.
Mr. Chairman.
Go ahead.
We don't have a do pass motion out there. We just have an amendment, right? So we're motionless right now?
I believe that's correct because we had a do pass motion, then we had a do pass, then we had a substitute motion. Substitute motion failed. We go back. There was a new motion. The motion was to amend, and we're at which we amended the bill. So at this point, Senator Dybert, if your question is, are we ready for a motion on
Mr. Chair, I move do pass as amended.
There we go. We got a motion to do pass as amended. I am so glad you high school kids are here for this one. This one you won't see every day. We have a motion to do pass as amended from Senator Peterson, seconded by Senator Melhoff. Any further comments on the motion to
I just refer to my previous comments. Thank you.
Thank you. Senator Dybert.
Thank you. You know, I was ready to vote on this right away with do pass until the sponsor asked us to table it. If a tabling motion would have been immediate without testimony, we'd have probably tabled it. So I'm trying to honor the sponsor's desire here. Thank you.
Thank you. Any other further comments? Senator Peterson.
Mr. Chair, I would venture to guess that the sponsor is in agreement with this motion. Thank you.
The motion in front of you is do pass, made by Peterson, seconded by Melhoff. Would the secretary please call the roll?
Senators Melhoff,
Aye.
Dybert,
Aye.
Hone,
Aye.
Carr,
Aye.
Colbeck,
Aye.
Larson,
Aye.
Perry,
Aye.
Peterson,
Aye.
Crabtree,
Aye.
Mr. Chair, we have all yeas.
After receiving unanimous number of votes, House Bill 1194 is hereby deemed passed.
Consent?
No consent. Yeah, no. With that, I would entertain,
Can I make a motion for consent?
anybody can deny it, so,
Oh, so you'd pull it.
yes. So we'll let whatever discussion's happening there continue to happen. With that, I take a motion to adjourn. Made by Colbeck, seconded by Hone. All those in favor say aye. All those opposed say nay. We are adjourned.
Formed. Good, useful, and full of wonder. SDPB.